Joining us right now on the Oakland County Megacast is Dr. Sanford Vieder. He is the chairman and medical director at the ER Trauma Center for Beaumont Hospital and the medical director for the Lakes Urgent Care. We appreciate your time with us here on the Oakland County Megacast. We know your time is important, so let's dive into the topic. Boy, you must be crazy busy right now.
Yeah, that's an understatement. We are very, very busy right now. Virtually every aspect of my life is crazy busy, and it's because of the pandemic, for sure.
So I'd like to kind of start off a conversation in thinking about, you're an individual, you're a doctor, but you're also, a member of our community. And when you see people out without wearing a mask, not taking this seriously, how does it impact you? What do you want the regular person to know in our community about COVID-19? 7 months in, some people just don't believe it's real.
Well, if anybody needs any proof, I'd be happy to have them share some time with me in the hospital or in the urgent care. But it's frustrating because there are simple things that we can all do to really help each other. And it's really what it comes down to, is it's a matter of not only helping yourself and your own family members, but also taking care of other people around you, your friends, your family. And the simple act of wearing a mask and just practicing good hand hygiene can do so much to just reduce the risk. It's not going to eliminate it 100%, but significantly reduce the risk of transmission and spread. And that's really what we're talking about. And I think, unfortunately, what I'm experiencing is that in the community, there's been sort of, we've let our guard down. And I even see this with healthcare workers, because they do great when they're in the hospital, they do great when they're in the office, and then they get home and they're tired of wearing a mask and they're tired of being careful. And the vast majority of healthcare workers that get ill don't get ill at work. They typically get ill out in the community because either they've let their guard down or others around them are being inconsiderate and not wearing a mask. So keep that in mind, because at the end of the day, once we all go down, who's going to take care of the sick?
Yeah. And, talking about that, I saw an interview on one of the local TV stations, and I won't say which one because I don't want to call out the individual that may have been interviewed, but it was someone who was working the polls, and they had an N95 mask on. It was so dirty. The outside was dirty. And I was like, number one, I will tell you, if I was a reporter, I would have said, hey, I'm sorry, but let me give you a new mask, because I would always keep extra mask with me. But it's just another one of those little things where you're seeing people are putting a mask on, but it's not sanitized and it's not clean. So how good in those situations does a mask actually do?
Well, surface dirt probably doesn't really impact the effectiveness of the mask. The one thing that will affect the effectiveness of the mask is moisture. So after some time, if the mask gets wet or gets sweaty, it can break down the fibers in the mask. But I would still rather see somebody have a dirty mask on than no mask at all. At least there's some barrier there. The other thing is that if you're going to wear a mask, wear it properly. It shouldn't be only around your chin or, not covering your nose or your mouth, because that's really the transmission point. So it's important to not only wear a mask, but understand how to wear it properly. Fortunately, in terms of mask supplies in the community and really across the nation right now, we are in much better shape than we were back in April. But that is a reason why everybody should be wearing one, and make sure that they've had an opportunity to try different types to see which fit better than others. I know that I have. Some fit me well, some don't. And it's important to understand which ones do and make that investment into wearing a proper mask.
So knowing that, because we do see people doing all the things that you just talked about, maybe wearing it around their chin or not sanitizing in between this, that, and the other. But as you just said, when we're talking about that, we're seeing this crazy surge in cases right now. The good thing is people aren't dying at the rate that they were in the beginning of this pandemic, and I think a lot of that just has to do with knowledge and education. It was a new virus, and now we know different ways to treat it. But going into the winter months with this crazy surge right now, do you think, what do you want the public to know? And can we stop it? Can we stop it without a shutdown?
I think it'll be difficult to stop it without a shutdown, unfortunately. I've often had a theory that if we could literally stop everything for 3 weeks, and I mean virtually everything other than emergency care, we would probably do a significant benefit to the community by getting rid of the virus in that fashion. Now, that's a really difficult thing to do, and I kind of heard some of the comments before. We don't live in a police state, and it's very difficult to get everybody to cooperate in a circumstance like that. In the interim, the reality of it is that you really want to mitigate and minimize the amount that you're going out and doing things right now. It's in everybody's best interest to do that. And one of the things that I really like to just kind of get the message across is virtually every urgent care and virtually every emergency department in the city now is incredibly busy. But a lot of it has to do with the worried well who want to get tested. Really need to try and reduce that as well, because we're now overwhelming again our reference laboratories, and that's why we're seeing 5 to 8 to sometimes 10 or 12 days turnaround for results. We do not have unlimited supplies for rapid testing. We do have some available, but it is definitely still limited. And it's important that if you're not symptomatic, the best thing you can do is stay home, reduce the amount of interaction that you're doing. There's really not a need to get tested if you're just curious, do I have it or not? You should have good reason and good logic behind why you're going to be tested. I'm beginning to have some symptoms I need to know, or I'm having some trouble breathing, or as previously I heard, you're taking care of a loved one who's immunocompromised and you want to be safe. Those are really valid reasons to get tested. Getting tested just because I'm curious, do I have it or not? And then taking the approach that, well, my test was negative, so I'm good. I can go do whatever I want to do. I'm safe. That is really the wrong message. We got to be very, very careful about that as well.
I love having you on the show right now, especially following our conversation, because 7+ months into this, and we've had this conversation consistently on the show, but it changes day to day and week to week. So it's great to have you on with us, because you got to keep in mind too, there are some jobs where people work directly with the community, and if they had a loved one that was exposed, they feel like they need to go ahead and stay home, then their employer is saying, no, you need to give me a test. And it's like, wait a minute, no, I was exposed and this person was positive. And so this is a great conversation to have. And as we go into these winter months, I guess 2 parts, like some people, we're just not surprised we're here because we reopened schools. We've reopened colleges. People are going out and about, but even as if we go out and about and we're following the mask guidelines, are we still going to have an increase? And because if we shut down again, it's going to flatten the curve. But once we start to reopen again, won't it just spike again until we have a vaccine?
Most likely. How that spike will go up is hard to determine. Nobody has a crystal ball, but that certainly could happen, and it may happen. There's no question that the vaccine will be yet another tool in our toolbox to help fight this pandemic, but it isn't the panacea that perhaps some people are thinking as well. The other thing about testing that people really don't understand is that, number one, if I had a high risk exposure today, I should not run out to an urgent care and get tested today. You want a minimum of 5 days since your exposure to test, because otherwise you likely have a potential false negative test. The other thing that's very frustrating is that employers requiring a negative test before returning to work. Most institutions now have policies in place with science behind it that you do not need to have a negative test to return to work. What you should do is be asymptomatic at least 10 days out from a positive test. And we are not testing anybody who's had a positive test in the previous 90 days, because even 70 days out from a previous positive, when you were sick, you're likely to still test positive because of the way that the test runs. It still picks up viral particles. And so it really is a misnomer to require employees or somebody else to have a negative test before they can be, reintroduced into the workplace or into the family bubble. That is not correct information. And so there's a lot of misinformation. You definitely want to make sure that you're talking with your primary care physician and understand the mechanics behind the testing. What does it mean? Just because I have a negative test, what does that mean? Does that mean I'm okay? If I've had a positive test, do I need to be tested again? Most likely you do not. And because we don't have unlimited testing capacity, we are going to refuse individuals an additional test if they've tested positive in the previous 90 days.
I think it's so great to have you on the show right now, because you're clarifying so many questions so many people have, because in the midst of this surge, just going to the urgent care, I have nieces and nephews that are home from college and they want to get negative before they go back to college, and this, that, and the other. And it's a nightmare right now to get tested, but people are getting a rapid test, which is different than, a week later they'll get their other test, and it's a different reading. So it's great to have you on with us to help clarify this, but also for us to share this information with people, to have honest conversations with their employers that are maybe saying no. Number one, people who are trying to be cautious that were exposed, saying, I'm going to take time off of work because I was exposed, and then not taking a test because they didn't have symptoms, and saying, you know what, we need to save those tests. We don't want to bog down the system. So it's great to have you on to just kind of clarify this entire crazy world right now that we're going through. And with that, what do you think the outcome is in the next 30 days? Is this going to get back to where we were all the way back in March and April?
Well, we certainly hope not, but unfortunately, a lot of the indicators are that we are going to get there. I can only speak from my own personal experience over the last several weeks. We are seeing a significant increased volume of positivity. And the one good piece of good news is that it does not seem to be as severe as it was back in April. In other words, we are currently not seeing the high number of respiratory failures and patients ending up on ventilators or perhaps even unfortunately passing away. It doesn't mean that that can't happen, and we don't really understand why. Has the virus mutated? Or something has happened. There's a little bit of a difference right now than what we were seeing before. Is it some of the public health measures that have helped to reduce the severity of illness? Perhaps. It's really difficult to figure that out. But I don't want people to sort of say, oh, okay, well, I might get it, but it's not as severe. That is true right now, and we hope it will continue in that fashion. But again, that is not reason or logic to reduce your level of, surveillance and being cautious and still taking all the necessary reasonable precautions that you can to avoid getting the infection or spreading the infection to others who might not be as fortunate and may unfortunately have a bad outcome because of the infection.
Dr. Sanford Vieder joining us on the Oakland County Megacast. Dr. Vieder, we touched a little bit earlier, you touched a little bit earlier on people going into urgent cares and into their other providers to get tested. While we're seeing, especially on the west side of the state and even to some extent at some medical facilities that are preparing for similar events on this side of the state, as their facilities are starting to fill up again with COVID-19 cases to some extent, people are going to the emergency room or they're going to an urgent care for care, what should they be considering before they go? Of course, if they're in an emergency situation and they need to be treated, they should obviously go and get treated. But otherwise, if they're going in for something that's maybe not an immediate need, or they're considering getting a test or whatever the case may be, what should they be considering before they go to these facilities to A, keep themselves and others safe, but also to make sure that they're going there in a prudent manner and not going there just because?
Yeah, great question. And I'm glad that you asked it because it definitely needs to be talked about. First of all, if you're having chest pain, if you're having stroke symptoms, if you are having severe abdominal pain, all of those kinds of emergent issues, you absolutely should not hesitate to go to the emergency department or to call 911. That is appropriate and you should do it. It may save your life. I want to be very, very clear about that. The second thing is that, again, if you are not having any symptoms at all and you're curious, I would advise those individuals to not go and get tested. You are contributing to the problem. You're going to bog down the laboratory systems, which are already stretched to the max. And the benefits that you're going to receive from that testing are going to be minimal. Now, where's that in between? And there is an in between. Here are some clear indications for why you should seek care. I have a fever. I'm having trouble breathing. That is an absolute indicator. And I would love to see everybody, and unfortunately I don't have one with me right now, or I would show it on the cast here. You can purchase what's called a Fingertip pulse oximeter, probably $25 to $35. Buy it at Amazon, Target, one of the local drugstores. Supplies, I think, are still really good. Back in April, it was difficult to find them. This is a device that you can put on your finger, and it gives you the percentage of oxygen in your blood system. It's a very, very simple device to use. Anybody can use it. And what I tell patients is watch that number. And if you approach 94% or less, that is an absolute indicator that you need to seek professional medical care. It doesn't mean that you're necessarily in trouble, but we like to see patients who are seeing that drop in their pulse oximetry, the percentage of oxygenation in their blood. That is a really good tool to use at home to decide, should I go in and get treatment or shouldn't I? You got to remember that the vast majority of COVID positive infections are treated with supportive care. What does that mean? It means controlling your fever, making sure you're getting adequate fluids, okay? Minimizing the opportunities to spread that infection to others around you. And if you begin to have any difficulty in breathing, that is a very, very valid reason that you should seek medical evaluation and care. Okay?
Doc, it's so great having you on here with this perspective. Quickly, because I know we're taking up so much of your time, but if I can just ask you for clarification, because we're seeing where so many colleges right now are requiring students to get a COVID-19 negative test before they leave their college campus and come home for the Thanksgiving holiday. Your thoughts on that?
Well, that's just my personal opinion, and I think that if they're asymptomatic, they really don't require a test unless they've been positively exposed. If they have a positive test, what are they going to do? Are they not going to be able to go home? That's a conversation that needs to happen with parents and family and decide how to best handle that in conjunction with their healthcare provider. requiring a negative test, especially in those individuals who have previously tested positive, they could continue testing for months and not come up as a negative test. Then what do they do? Again, you can't look at this stuff in a vacuum. You've got to use it in conjunction with what is the history, what does the physical exam say, what is the epidemiologic risk factors associated with that potential positive exposure or positive test or negative test for that matter. And it can't be just a mandate, in my opinion, that you have to have a negative test and therefore you go home. You can have a negative test that's a false negative. And so are we creating a false sense of security? Again, it has to be interpreted in conjunction with why are they being tested? Were they exposed? Do they have a roommate that was a confirmed positive exposure by PCR testing? That's a lot different than 3 roommates who are also negative by an antigen test, a rapid antigen test, which is not 100% sensitive.
See, this is why we have different people on the show here on the Oakland County MegaCast, because we're able to get a long, in-depth conversation on these very important topics with people such as yourself, because you know so much more than we do. And knowing that, we want to say thank you for your time and thank you for your insight. You have offered a very important conversation for us all to have as we go in to the next few weeks and the next few months, because we're talking about testing and we're talking about hospitals and capacity, but having your perspective has been enlightening. So we so appreciate your time. And quickly, before we let you go, anything we didn't ask that you want people to know before we let you go?
No, I would just say this, everybody, wear a mask, wash your hands, stay safe, and create that bubble of immediate family and stay with them right now as much as you possibly can. I know the holidays are upon us and everybody's thinking about, how are we going to celebrate Thanksgiving and Christmas and New Year's? And, unfortunately, there will be many more in the future. You need to celebrate either remotely like this on Zoom or with your immediate bubble, your immediate family, and stay safe. So I wish everybody a happy holiday season and stay healthy.